The truth about autism: why incontinence is more common than you think. People with ASD are at a higher risk of developing or experiencing incontinence compared to those who do not have ASD. This is due to the fact that people with ASD can have multiple types of incontinence, which can change how incontinence is managed. People with ASD may have difficulty communicating their need to use the restroom, may have difficulty with bowel or bladder control, or may have sensory issues that make using the restroom uncomfortable. All of these factors can lead to incontinence issues for people with ASD. The types of incontinence with autism. There are 4 primary types of incontinence experienced by children and adults with autism. Urge incontinence. Urge incontinence is caused by an overactive bladder, which can lead to frequent and sudden urges to urinate. This can be a particular problem at night, leading to bedwetting. Functional incontinence. Functional incontinence occurs when there is a physical or mental impairment that makes it difficult to get to the toilet in time. For example, a child with autism may not be able to communicate their need to use the toilet in time, or may be unable to physically move to the toilet in time. Bowel incontinence. Bowel incontinence, or the involuntary loss of fecal matter, is a common issue among children with autism. Studies have shown that children with autism are delayed in developing bowel control compared to children who do not have autism. This can often be a source of stress and anxiety for both children and their caregivers. Difficulties toileting. Children with autism may develop the ability to use the toilet on their own at a slower rate. There is difficulty knowing when to use the toilet, communicating the need to go, getting to the toilet, cleaning themselves, and using different toilets. Autism can make it hard for children to know when they need to use the restroom, communicate their need to go, get to the restroom in time, clean themselves properly, and use various types of restrooms. All of these difficulties can make it hard for parents to potty train their child with autism. How incontinence products can help. As children with autism grow older, they often develop the ability to control their incontinence through training and repetition. However, during this time, incontinence products can be a huge help to parents and caregivers. Knowing that an accident will be contained, and that skin will be protected from wetness and rashes, can give parents and caregivers added peace of mind. The right overnight product can even provide a better night's sleep. So it may take a little extra work with your child to take steps towards using autism diapers or pull-ups less. As your child's primary caregiver, remember that you know them best.